One of the things I really like about being a doctor, particularly in my specialty, is using my ability and expertise to help people make a difference in the way they live their lives in order to help improve their health for the short but also the longer term. I use London Medical as a base because diabetes is a condition which requires the input from a whole range of different types of professional, and everyone is here at London Medical. I treat people with type 1 diabetes, type 2 diabetes, also with pre-diabetes, and there are a whole range of treatments available now to help people achieve the best possible control. Of course I will use medication, but a big focus of my practice is to encourage people to use their lifestyles as much as possible as a means of enabling them to achieve good control of their diabetes. I became very interested in developing education programs so that people with those conditions had the tools they needed to get their condition under control. I was asked to write a book initially on type 2 diabetes. It was entitled Reverse Your Diabetes because at the time the knowledge that the condition could be reversed was quite new. This was followed up in 2018 by a book on type 1 diabetes. And then also last year I was very fortunate to team up with Emma Porter, who's an amazing food writer who lives with type 1 diabetes and has helped put together some recipes that are really helping people to control their condition. The reason I chose to specialise in diabetes is that very early on I became quite fascinated by it as a condition. Although it's predominantly a problem relating to hormones and metabolism, it affects just about every part of the body. It affects people of all ages and of both sexes. And so I felt this is a condition that I could work as a specialist but still maintain a broad interest in a number of other areas of medicine that are impacted by diabetes. I'm sometimes asked what made me choose medicine as a career. It's something that was with me as far as I can remember from quite a young age. I felt that I wanted to be a doctor. It didn't come from any family background. My parents were both bakers. I was the first person in my family to go to university, but I had something there for as long as I can remember that steered me to wanting to go into medicine. One of the questions I'm frequently asked nowadays by people with type 2 diabetes is, can I reverse this condition? Can I put my type 2 diabetes into remission? And the answer in some cases is yes, you can. And that's a very exciting prospect for people who previously were given a prognosis, which was that the condition will just get worse and worse. That doesn't have to be the case anymore. And so the advantage of coming to London Medical is that we have access to all of the latest technologies together with the clinicians who have the expertise to enable you to get the best possible results from them.